Hey everybody, what's going on? Dr. Chad Woolner here.
And Dr. Buddy Allen.
And this is episode 15 of the Health Fundamentals Podcast. On today's episode, we're going to be discussing the what and the why of your health problems. So let's get started. You're listening to the Health Fundamentals Podcast. I'm Dr. Chad Woolner.
And I'm Dr. Buddy Allen. And this show is about giving you the simple but powerful cutting-edge tools you need to change your health and your life.
So sit back and enjoy the show as we show you the path to your best life down to a science. So hey everybody, hope you're having an awesome day. On today's episode, we've got a great topic and subject that we're going to be discussing, and that is the what and the why of health problems. And unfortunately, what we find far too often when it comes to so many of the most common approaches to either managing or fixing various health concerns or health problems is that the primary focus is all on the what of the health problem. So what do we mean by that?
The what is essentially just the diagnosis, all right? And the fault with that is it's important to know what's going on, but more importantly, it's kind of like how did it happen? Why? What caused it? What created it? Because we frequently will have people come in and they'll say, oh yeah, I was told I have this, like back pain. I have a lumbago.
Right. I have sciatica.
Exactly.
I have, insert whatever term is used. And the problem with so many of these diagnoses that are used is they don't really give us much in terms of any real answers. It's really just a starting point is really what it is. Something like, for instance, so many times all diagnoses are fancy words, right?
Exactly.
Lumbago, which is Latin for low back pain, cervicalgia, Latin for neck pain, cephalgia, Latin for headaches. Or even further, sometimes people think that they've arrived at an answer when they get diagnosed with something highly specific. Like, let's say I've been diagnosed with migraines. I have migraine headaches. Or I have anemia, right? And so the problem is that, again, we're still at a surface level there. If you could imagine almost like layers of an onion, we've got to peel away at some of those layers if we're going to begin to truly fix the problems. And I would argue that our intention and our goal and our mindset should always be to fix the problem and
Absolutely.
Not just mask symptoms. And if you're working with a doctor who doesn't believe that your problems can be fixed, I think that's selling yourself short, selling the body's recuperative abilities short. And I think the body is capable of miraculous things. And so we always approach, our approach is always from a standpoint of, can we fix it? And if so, what is not sufficient? We've got to dig deeper. And so we've got to answer the other question is why? And oftentimes it requires us to kind of peel away multiple layers. That why question needs to be asked oftentimes 3 or 4 times for us to truly arrive at a real answer. So let's take, for instance, back pain, right? Yep. You've got back pain. So what's the first question?
There's
in terms of why. Let's say for instance, you come in with low back pain, and the first question of why do you have low back pain? Well, I've got severe muscle spasms. Right? Patients will often say that, right? Yeah, my muscles are just really, really tight, and they're in spasm, and they're bound up. And that may be the case. Upon evaluation and examination, we find that, yeah, you do. You have really, really spastic, really, really overly tight muscles in the low back. But again, if we ask why again...
That's more of a what still.
Yeah, it's still a what. Yeah, exactly. You've got tight muscles. So then why do you have tight muscles? And let's say that we find upon evaluation what? I mean, just throw it out.
You could have a rotation in your pelvis.
Right. Your pelvis is rotated. Something mechanically is shifted. And again, we could still ask, well, why?
Okay.
And upon further evaluation, it could be that we find that the way you're sitting at work, or the fact that you just sit for prolonged periods of time at work, or the fact that you had an old injury to that area, or any number of reasons. But once we start answering the why of it and answering several layers deep, eventually we can kind of get to, if we can get to the source of it and the cause of where everything began and what caused it in the first place, that's when we can start to really do the most good for people and help them. And I think that's one of the most important things that as patients, we need to demand that. And not even necessarily demand it of the doctor themselves, but demand it of ourselves. You know what I mean? Seeking that out. If you're working with a doctor who's either unwilling or incapable of answering those questions, then that's when you start seeking out the help from other people, other, and I don't want to say other people, other trusted healthcare advisors will say that, So what are your thoughts on that?
Well, the thoughts that I have are, the reason that why is so very important is there's a lot of different reasons you could have any type of given diagnosis, all right? Because low back pain can be caused by dozens of different scenarios, right? It can be caused from gut issues. It could be caused from ulcers, kidney stones, you name it. There's tons of, torn muscles in your hip flexors. Who knows? There's a lot of different things that could cause low back pain. And if you, and again, that's from a practitioner.
And that's just one example. Low back pain is one example of, we see patients who commonly have, obviously, low back pain, but we also see patients who have neck problems, shoulder problems, knee problems.
Well, and another thing that's important about, like when we're trained as physicians to diagnose, and then as we dig deeper, it's like generally what happens is, you kind of want to start with the most potentially life-threatening things first, and ideally rule those out, the most severe scenarios first. But then from there, you kind of just, by asking the right questions, you can find out, is this something that came on suddenly? Is it something that's been developing over time? Did it come out of nowhere?
Well, and I think it's important to address, too, that while we certainly, and I appreciate you saying that, because we don't want to be negligent with people and skip through any of those important things of ruling in or out any of the, what we would consider kind of red flag issues. Sure. But usually, more often than not, within a few minutes, we can rule in or out that sort of thing. And then beyond that, it's not a matter of looking at what's possible. It's a matter of looking at what's probable. And that typically 9 times out of 10 is going to get you the best clarity and the greatest value in terms of finding out answers to that why question. Oftentimes what happens sometimes, especially you'll find this in really large medical settings, is that they will go through and they will run a lot of tests. A lot of tests unnecessary. In fact, there was a study that was just done a study that was published. University of Michigan Health Systems did a study for neuropathy. What they found was that more often than not, expensive, ineffective testing was utilized when there was far less expensive, more effective testing that could have been done. And that's the interesting thing. And this isn't the only time that's been the case. There was a study that was published that compared, and I can't remember the source for that, but I remember us discussing it in school, where they said that if you compared an MRI of a low back disc herniation compared to a complete neurologic and orthopedic evaluation of a patient with a disc herniation, they found that the ability to arrive at a correct diagnosis was comparable. And so basically what they found was that in many instances, it's not necessary to order that MRI. Typically, when the time in which it is appropriate to order an MRI, let's just say, is when you find that a condition is not responding to care, that there is suspicion of some sort of spinal cord involvement or problem there, or there are progressive neurologic deficits. Those are typically, or pre-surgical. They're using it as a means of a screening tool in terms of looking at what they're going to be operating on or whatever. But far too often, and this is something that we're not necessarily as concerned with in our clinic, just because it's not the same type of setting. But oftentimes in a lot of medical settings, they're very overly cautious in practicing what they call defensive medicine, where it's because of the nature of the world we live in today,
the litigious nature of our culture.
Right, exactly. So, but I guess the point that we're getting at here is it's really important. If you're really wanting to fix problems, you got to arrive at clear answers. And just addressing the what does not give you sufficient clarity on how to go about fixing the problem. You've got to also address the why. Why are you dealing with the problems you're dealing with?
Well, and the what can vary in many instances be covered up by, if I have a headache, which is the what, it's real easy to say, I'll just take a couple Advil.
Right.
All right. And you can do that. And maybe it's something insignificant, and probably more often than not it is.
Right.
But it could also be something very serious and severe. And so it's important to know why and why for the what,
Yep, absolutely. Getting clarity on that is going to be a huge factor in you getting long-term results.
Yep.
In fixing health problems. So, the advice, a recommendation is work with doctors who are going to be able to answer not just the what, but the why as well. And the way we do that at our clinic, is, and every clinic's going to be different. They're going to have different protocols and procedures, but we try and be as thorough as possible in addressing this. And so we go through and we use a variety of different objective measures and tests that allow us to get a very clear picture and a very objective picture of where a patient is at and what are some of the factors that are involved. We do a full functional evaluation from head to toe. We look at balance and stability. We look at strength and coordination, and we look at flexibility and quality of motion throughout the body and the various joints of the body. We do a digital balance assessment. We do a digital posture assessment. At times, if necessary, we'll do digital imaging. We'll take x-rays. In fact, more often than not, we do. And then as well, we can look at and measure range of motion digitally. So there's a lot of different things that we utilize. And then obviously as well, the hands-on physical examination, or what we call a problem-focused exam, where we look at the various areas that are involved. And based off of all of that information that we're able to look at, we're able to see very clear patterns that allow us to answer loud and clear the why as well as the what. And so I guess that's the take home, is really if you want to fix health problems once and for all, you've got to dig deeper, and you've got to be willing to dig deeper. And so that's the thing. As patients, we have to take responsibility for our health, and we have to be willing to get those answers.
And to put the work in when necessary.
Absolutely. Yeah. And that's the thing. We tell patients all the time that when you come to our clinic, it's not a passive process. It's a very active process. And that could sound daunting, I think, sometimes for some patients, but that's why we have a team in place.
That's right.
To help you, to assist you. And it's easy. It really is. It's easy when people flip that mental and emotional switch, when they're ready to stop being a passive kind of bystander watching life go by, and instead be an active participant, and I should say a proactive participant in their health. So take charge of your health. Don't sit back and just accept the what. Also look for the why. And once we start answering those questions, once you start getting answers to those questions, it's going to take you a lot closer to getting the help that you need. So anyways, hope that's valuable, and
we'll talk to you again real soon.
Talk to you on the next episode. See you guys.
Thanks for listening to the Health Fundamentals Podcast. Be sure to subscribe so that you stay in the loop and in the know with all of the cutting-edge health information that we share. If you know other people that could benefit from this information, please share it with them as well. Also, be sure to give us a review. These really help us to ultimately help more people. Last but not least, if you have questions that you want answered live on the show, or if you have ideas for topics that you would like us to cover, please shoot us an email and let us know at info@thehealthfundamentals.com.